All right, everybody, welcome to another episode of the Here for Healing podcast. I'm super excited today because we have a biological dentist in the house. Well, we're on Zoom, but we're connecting with a biological dentist today. And for those of you who have followed along my journey, my cancer healing journey since 2019, the connection of dental health and systemic disease was really at the root of my personal cancer diagnosis. So it's something that I've shared a lot about. I've gone through so much when it comes to my dental journey. I'm going to share a little bit more about it. But it's also what some of the questions that I get asked the most on social media are about dental health, about, the difference between biological and conventional dentistry, how to know if there's an infection, what's the connection between dental health and our overall health. So this is some of the stuff that we get into with Dr. Corbin Popp, who is a biological dentist in the Denver, Colorado area. So thanks for being here with us today.
Thank you very much for having me. I appreciate it very much.
Yeah, and I would just love to hear to get us started, what first opened your eyes to the connection between overall health and oral health that made you really want to become a biological dentist? Were you a conventional dentist first and made the switch, or did you know you kind of always wanted to go more of the biological dentistry route? Just get us started by telling us a little bit about that journey for you.
Well, I didn't set out to be a biological dentist. I was always more of the devil's advocate. I started to work for a biological dentist in Denver, and honestly, I got to do that because it was a non-insurance type thing. It was really for nothing. I truly felt like I was holistic. I could talk to the patients very much, but very soon I started to realize the difference between that type of practice, holistic biological, versus the public health, which is what I was trained in a little bit more. And public health is, Medicaid, Medicare, very, very lower income, placing a lot of amalgam fillings, doing a lot of root canals, emergency dentistry, basically. When the biological dentistry was all planned, master planned. And what I noticed first is patients, they didn't have periodontal disease. Some, of course, do, but nothing like public health. And I really attribute a lot of it to is we kind of joked about it is they were gluten free walking in the door. And
Mm.
so you start to see, oh wow, okay, the mouth, which is the start of the gut, is already in a lot better condition and with patients that are much more holistically oriented or biologically oriented. And so that really it got my attention really quick. Now I was still a devil's advocate for sure because we were still doing like titanium implants. It wasn't until I went to Switzerland on an invite with the Swiss Dental Solutions and learned a little bit more about the zirconia implants. And I had a patient I took there that had a huge transformation by removing all interference fields, which is basically anything metal or dead. And uh, and that totally changed my viewpoint, and I haven't even thought about going back to regular dentistry, if you will.
How long have you been in the dentistry field?
Well, my history is a little different. So I've been since 2014 is my residency ended. I did a surgical residency. So I'm a little late start for the dentists because I was a professional Broadway ballet dancer for 10 years before. So yeah, almost 12 years now.
Okay, Broadway dancer to biological dentist. When did that happen though? I mean, I hear 2014, but what, you're dancing on stage like, okay, I got to get into the mouth. Like you got the shift
Yeah,
happen.
yeah. Twins. That's what did it.
Okay.
Yeah, twins on the way. And my wife and I were kind of grounded. And with twins coming, I was like, I need to go back to school because before I was a dancer, I was mostly pre-med,
Mhm.
looking to go to medical school. And so I had all the prerequisites. It's a really awkward or different type situation than most dentists have. I was really lucky to have all those prerequisites. And my dad was a dentist. So I knew how to wax teeth, and I did that when I worked in the ballet. So it wasn't terribly hard to get back into the swing of things. So I went back to school in 2009 in Arizona. And so I was a little older in my class, but It was great and a great thing I did. And it's still in the arts and sciences, really.
Yeah. Okay. Interesting. That's what I was trying to find. I'm like, where is the connection of dentistry though? So your dad was a dentist. You grew up around this. Was he a more conventional dentist?
Totally,
Okay.
totally conventional. Yeah, I mean, I had amalgam fillings that he put in me. Now he has long passed away, but yeah, very much conventional, and all my upbringing was all conventional. It's all tooth mechanics and not really looking at the whole body. Even my schooling, which was Arizona School of Dentistry and Oral Health, a public health school, but they would do a lot of root canals and mercury fillings on children and people with lower income.
So who removed your amalgam fillings then? Your dad put them in. Who took them out?
Yeah, so the guy I worked for in Denver, John Augsburger, he had Biodentist was the name of the practice, and so by the time I got with him, it was like, okay, now I need to go and go have some of these things done, cavitations, had a root canal removed, and amalgam fillings, and because you need to do it really safe, and so I'm glad I waited because a lot of dentists will just drill it out, swallow and don't worry about it. It's safe. And that's just not the case for a lot of people.
Okay, so talk to
So
me about that because that was a really big part of my mom's journey. My mom had amalgam fillings. And so you're talking about mercury in the mouth. She had a lot of health concerns, a lot of health concerns that came as a result of it. She started learning about, heavy metal poisoning from mercury in the mouth. She had them removed and she had a 180 in her health and how she was feeling, in her energy, in her vitality. So for some people who might not understand this, they have mercury in their mouth, they have these amalgam fillings. What is the problem with that? And what can they do about it? Because what you just said was like you don't want to just go to any dentist to have them removed. So talk to me a little bit about that for maybe someone who's hearing this for the first time.
sure. Well, an amalgam filling is basically 50% mercury. It's another almost 50% silver. So it does have a component that's very toxic. Some people call it the most toxic, element on Earth, mercury. It'll disable all kinds of enzymes, hormones in your body, which can be very damaging for some people. And I say for some people, there are other people they detox well. So I say, and jokingly, sometimes there are people you can't kill them if you try. But there are people that are much more sensitive, and I think more so now. So if you have mercury fillings, let's say, I think there was a study. Oh, it was in the teens in Canada, I believe, did it. If they had six mercury fillings patients versus patients that had none, they could measure the level of blood mercury, and it was nearly double in the patients with those mercury fillings. So the fillings are a very high source of mercury, and there are different types of mercury, but the vapor is really the most toxic. And so like every time you have hot coffee or you chew, you do release vapor from these mercury fillings when you get a cleaning. And so yes, they for people this can it can start with the thyroid. Very often it's kind of the canary in the coal mine many times. But anything, and it'll get stuck in the fat, hard to detox. And yeah, it can really kind of mess up all of your healing journey. And if you don't know about it, it makes your practitioner suffer to try to get you through it. A lot of dentists have this problem. I mean, Mad Hatter disease, the same kind of thing. But so you can't just drill it out. You need to be able to take it out safely. Otherwise, you can make the patient really sick. And some people they get sick when they have the mercury taken out because they haven't done the detox kind of protocols before. They haven't had it taken out safely, which looks like a hazmat situation in the dental office. And then detoxing afterwards. So there's really it's a rounded thing that needs to be looked at from a bigger picture standing back for patients that are really sensitive. And again, there are exceptions. So there's definitely a disconnect, I think, with the general dentists and the biological dentists, because some people you can, like I said, you could do anything and it doesn't really phase them so much that we see. Now, hidden below the surface, probably something. With so much neurological disease now, autoimmune disease now, inflammatory disease, you start to look at these things a little bit closer and say, hey, they're probably a little more important than we've given credit for in the past.
Why is mercury still used in some conventional practices then, given that pretty much everybody knows this about the risks of mercury?
That's a great question. I think when I hear Russia has banned it like 10 years. And Europe's not using it much at all. Maybe Germany. Germany's one of the only ones that still does it in the US. And it's usually people with low income and military, I believe. It holds up well. It's a great material, to be honest. It was fun to place them. It doesn't decay because it's toxic for bacteria, just like you. But it holds up well. There are people that have mercury fillings for 20, 30 years. So from a public health perspective, they, the government really thinks it's very economical,
Mm,
and that's kind of the angle, and because it holds up well. Now, it's also been done for a long time,
mm,
so it's really hard to go and say, oh, hey, by the way, these are toxic. Then you imagine all the lawsuits, I would assume. So the change is always slow. It is that way. But eyes are being opened more and more. At least in the US, I think under the age of 5, or if you're pregnant, they don't allow them, which is a big sign, right? So it's a great question, but you could ask that for so many things. I mean, fluoride would be another one. Is why when we know all this do we still do what we do? There's an idiom, it's never mind the horse is blind, just keep loading the wagon.
mm,
That's kind of what we do sometimes as we're humans.
yeah.
But I wish I had a better answer, and I wish things would change quicker, but they're changing for
Yeah.
you. You're helping it. Yeah.
Yeah, for sure. There's so many downfalls with the internet, and there's so many incredible things about it that we get to spread information like this far and wide across the world. So, what are some safer alternatives then to mercury fillings? What should people opt for instead?
Yeah. Well, it depends on how big that filling was. If it was really small, it seems like it's too traumatic to make it into a ceramic crown or an inlay onlay because you're cutting so much of the tooth, which is also a potential problem because you could kill the tooth. So there are dentists, I think, that want to be biological, but they could get into trouble if they start taking mercury fillings out and the teeth die.
Mm,
Because then what do you do now? If you don't do root canals, you extract, it becomes a problem. So you have to be very conservative of how you take them out. There's a protocol of how to take them out. If they're smaller, I'd say that the most common thing to do is to do a composite, which is it's a biocompatible plastic basically. The question will be in 10 years is that a problem?
mm,
Um, and I ask the question all the time, but at the moment, from what we know, it's a much better and more biocompatible, safer, less toxic material if it's fully cured and in place. And does it last as long? Research shows it does, but I would say they need replacement over time, just like most fillings do.
Okay. So I want to share a little bit about my story for maybe listeners who haven't heard that part of it because it's really important to both our dialogue today and my healing journey as a whole. So
Yeah.
I'd been a healthy individual, eating well, teaching yoga, going to the farmer's market, working out. And in 2019, I was diagnosed with metastatic thyroid cancer, which cancer is always a shock, but it felt specifically shocking to me. I was 33 years old at the time and feeling like, don't smoke, don't eat fast food, don't, meditate. I'm like, how does this happen? The immediate recommendation was invasive surgery, remove my entire thyroid, 30 to 60 lymph nodes in my neck, radiation treatment, hormone replacement the rest of my life. And I was never anti conventional medicine, but I also knew the cancer recurrence rates are around 50% of people have recurrences. I had an 8-month-old son at the time. I'm 33 years old, and I'm not interested in being part of those statistics. So I put conventional therapy on hold to really dive into the root cause of how this happened to me. And I ended up at an integrative cancer clinic. And one of the very first things, the doctor sat down with me and he said, "Tell me your story." And I'm telling him my story. And part of my story, he was like, "Start at the beginning." So I'm like telling him my upbringing, yada, yada. I get to college. And when I was a freshman in college at Penn State University, I was at a frat house and I was not drunk. We had just gotten there. We'd been there like 20 minutes, but though I fell, I slipped on beer on the floor. This is just like a ridiculous story. But I believe that this happened to me for a reason. I believe that God put me on this path because I'm meant to be a voice for healing for people. And he said, "I need you to go help heal my people, but I need to put you through it first." So he did just that. I fell at the frat house, and the way that I fell was like my legs and then my belly and my face was the last thing to hit a cement floor. I knocked out my two front teeth. I broke the upper bone in my mouth, and I did 7 years of reconstructive surgery on my mouth. To think I'm all good, I'm fine. I rebuilt my smile over that time. It was really a very hard chapter of my life to then find out that I had cancer. That was about 2019. I graduated in 2007. That happened in 2003. So about 15 years later. So I'm telling the doctor this entire story, and he goes, "It's your mouth." I'm like, "What do you mean it's my mouth?" He was like,
Yeah.
"Well, there's a connection between head and neck cancers and disease of the mouth, including I had a titanium implant, I had root canals, and he sent me to a biological dentist. I was in Florida at the time. And when I got to this dentist, he did a 3D cone beam scan, and my mouth was black with infection. This doctor actually said, "You're lucky that it was cancer because like the bones of your mouth could disintegrate, like the bones of your face could disintegrate because of how much resorption there was, like my bone was being eaten away, and because of how bad the infection was." So I spent the next 6 months doing work on my mouth, taking out the titanium implants, the root canal teeth. I have photos of me on my Instagram walking around without two front teeth for like 3 months while my bone healed. It's just like the funny chapter of my life. I'm like, clearly, I'm not like I didn't get in a fight. I'm not homeless. Like people know there's something going on. And I just rocked no front teeth for a while. And I had to spend a good amount of time clearing out that infection. The dentist put ceramic implants in place of the titanium implants, but he made a mistake in that he didn't let the bone heal long enough before he put the implants in, and those implants failed. So I now have a bridge from canine to canine. This is a bridge here. People always say, "You have such a beautiful smile." I'm like, "Thanks. It was really expensive and really torturous to get it, but thank you so much for that." Um, and once the infection was finally out of my mouth, I say we turned off the faucet of disease, right? The very thing that had been causing this systemic disease in my body that had been shutting off my immune system. Once I finished the getting the infection out, I turned that faucet off. So the dripping of disease wasn't going into my body anymore. This is how I envision it. This is like how I think about it.
Good.
And that's when I really think that my healing began. Then all the detoxification that I was doing and the green juice and the nutrition and the prayer and the meditation, all of that started working once I know that's like I'm trying to get healthy, but I'm still eating McDonald's every single day, right? You have to stop eating McDonald's to create the shift in your body that you want. And so biological dentistry just became something I became a huge advocate for because I said, my goodness, when I was first diagnosed, this doctor said surgery, radiation, drugs, we're going to get you in. I said, what if I hadn't taken out that infection? What if I didn't pause for a minute and say, what is the root cause of why a healthy 33-year-old woman is diagnosed with cancer? We now know that thyroid cancer is one of the fastest growing cancers. It's had a 200% increase in the amount of people getting thyroid cancer. And they're just going through the standard of care without saying, pause. Why did this happen? Now, I hope that my page, my voice, my podcast serves as a pause point for people. But I just thank God that I really explored the root cause. And for me, it was the connection of my dental health. So, talk to me a little bit. Obviously, root canals and titanium implants are two of the things that put a major stress on our immune system. Tell me about, let's start at root canals. Talk to me about that and how they can affect our immune system.
Well, first, I'm so glad you found your way.
Thank
We would say if you're in the shower, don't start drying off. So if you have all these infections, and you're trying to heal, it's sort of contradictory,
Yeah.
for many people, because whether it's root canals or metal or titanium implants or cavitations, dead bone, any metal or dead bone, and that can be periodontal disease too. All that systemic, there's little messenger cells, chemokines. They're inflammatory.
Hmm.
One big antes, there's TNF alpha, interleukin gamma. And they are gonna kind of take over and hijack your immune system while other things can happen, cancer, inflammatory conditions, whatever that may be. So you ask about root canals. Well, root canals are they're dead. So again, this isn't probably for everybody, but anybody that's trying to be optimal, this is for them. Anybody that has inflammatory issues or cancer, even in my residency, when there was a cancer patient, you'd be like, well, let's look for anything, double check, remove the root canals, because they're dead. They'll be filled
So
with bacteria.
I
They're
have a question.
porous. Yeah.
I've heard it said 100% of root canals are infected. Yes or no?
Well, it depends on how you define infection.
Okay.
There's acute infection, there's chronic infection. I think 100% of root canals are filled with bacteria. That's clear. And your body is going to try to, well, it has to wall that off. That bacteria becomes anaerobic. They're toxic. So I would say yes and no. Yes, there's a chronic infection. There's walling off being done, but they're not 100% acute.
Mhm.
And again, some people have a rocking immune system and they can have a bunch of root canals, but we see it all the time where that's just not the case.
Mm.
Especially if you think about it I think about it the toxic bucket analogy. Your bucket only can take so many toxins, and we have so many more around us now. And the root canals, they add to it too. Whether it's an immune response, being that you might have a toxic material that you're reacting to because the sealer in it. Then there's the bacterial part too, which is it's filled with bacteria, so your body's going to have a response to that. If your immune system can't wall it off over time, this happens all the time, the root canal now becomes acute infection, hurts, pain, swelling, bone loss, And that's, I think, a little bit easier to say, yes, those have an acute infection. But I would not disagree with you to say that they're all infected to some degree. Yeah, absolutely. I think in some places they can serve a purpose, maybe for a short time. You could argue that for younger people to keep the bone level, to buy you time because you can't, you'd go into a surgery, yes, remove them, that's great, but you need to be regenerative capacity up before you do surgery. That's biological dentistry, is preparation before emergency treatment. Because you could have an implant that fails. If you don't know your vitamin D level, if your vitamin D level is low, that bone may not mature quick enough, and you could have, even with ceramic, you can have a failure. So I wouldn't just say, hey, jump right into removing those root canals. I'd say talk to a good biological dentist and plan it. They're all very prone to acute infection for sure.
Yeah. What does some of that prep for the biological dentist look like? You just said like looking at vitamin D levels. What else would you do with a patient to make sure their body's in the right state to handle some of these surgeries and things?
Well, yeah, there's a lot of training now on this now. Dominic Nischwitz is really great. He's a German dentist. So, you work on nutrition in diet first, reducing inflammatory foods, boosting your nutrient levels. So that does help. I refer. I get a good functional doctor and really say, hey, it depends on if it's a big surgery, like you just have to really make sure because you're spending a lot of money.
Mhm.
Because dentistry, the overhead is a lot. It costs its time and money, and so you want a good result. So it starts with nutrition and nutrient development. The Swiss came up with a really good protocol for this. They would have patients really boost their vitamin D level, and you want that vitamin D level high. You want it in like the 80s.
Yeah.
between 70 and 100, and normal for a regular blood test is like what, 40 something, and that's very low. There's a 300% greater risk of implant failure with low vitamin D, and that's in the literature. So I think that's customizable for probably everybody. It's not a one size fits all because everybody's built a little different, right? And
Mhm.
so I can't just say, hey, you take this D, you're good to go. What I recommend is work with a team. Your dentist is your guy, but he also should stay in his lane, he or she. And they can make good suggestions, but it's great to work with somebody that's their lane and that's what they're going to do. And they're going to get your regenerative capacity. If you're going to feel better already, but then you get the dead stuff out and the metal out, then you let your body now, because you can reset everything. Now you can heal. So that's why it was great for you to do it all. And that's
Hmm.
what the Swiss would do, is they would do it all, because otherwise you're drying off while you're still in the shower. If you only take that one out and you leave that one there, it's sort of like you can do it, and sometimes you have to because of time and money. But I think the best results I've ever seen, and they're the best cases ever, they do it all, and they do it really relatively quickly. And you see transformations like you. It's beautiful what you just said, and you do have a great smile, and I understand the challenges of bone building and implantation and stuff. So yeah, kudos to you.
Yeah, and this is like the true explanation of biological dentistry in the most simple terms. The way that I explain it to people is conventional dentistry is just looking at the mouth. It's isolating the mouth from the rest of the body, whereas biological dentistry is looking at the whole body system and how how the mouth is connected to all of our organs and the entire system. How do we support the immune system before we go in to do these dental procedures? How do we support the immune system after? And how do we create foundational changes to our nutrition, to our supplementation, to our dental care, our lifestyle, so that no disease comes in the future either. Like that's to me the difference. Biological dentistry is whole body. Conventional is isolated, just looking at the mouth. Do you feel like I missed anything in that comparison?
No, tooth mechanics is the general. Yeah, biological dentistry is comprehensive. It's taking a step back. You have to sit and, just like your doctor did, he had a conversation with you. You got to have those conversations, and you really got to get why are you here? What is your goal?
Mm.
You can really get a sense of what a patient's looking for. If they're like, I'm hurting here, that I'm like, I'm probably not your guy, because I'm gonna look all here, and that again, that's when you see these wonderful transformations, which is why I don't think I could ever go back. So comprehensive dentistry with a very good a look at materials and reducing inflammatory sources, which is really simply said, anything that's metal, which always metal corrodes, that's the FDA would tell you that, and anything that's dead, either it's periodontal disease, decay, dead bone, dead teeth, those types of things. You start to remove those, boy, you see transformation sometimes, and sometimes they're like miracles.
Mm.
Other times subtle. So it's a part of the big picture. I never tell patients there's a magic bullet, but the gut as a whole is so important, and this is the start of it. It's
Mm.
it's so important, the mouth.
And what I heard you say earlier is that there are some individuals where they're just so robust or their immune system is so strong that they can actually handle these conventional treatments like amalgam fillings or root canals. But if there's someone who's having something going on, autoimmune, feeling tired, not getting any answers from the doctor, a cancer diagnosis, bleeding, inflammation, like they have something going on, um, this is then when they need to go, beeline to a biological dentist and start looking at some root cause things, right? So it's that, does that sound accurate?
Well, yeah, I'm trying to be as careful with the word need.
Yeah.
But that's another thing I think in biological dentistry is you don't need it. You don't need teeth. You don't
Okay.
need
All
it.
right.
And that's a little bit more of, look, this is what we see. If you're having these conditions, absolutely inflammatory these chemokines from root canals or metal, or they affect the whole system. They just
Mhm.
do. Everything that you swallow goes downstream. It affects your gut. So if they want optimal health and they're looking for that, then you definitely have to look in the mouth. Sometimes first it helps,
Yeah.
but it's a big picture type thing. And I would say some people are like, well, I feel good, doc, and I have this and everything. That's fine. But look at how much neurological disease we have.
Hmm.
So you may be good now, but what does it look like in 10 years when your inflammatory markers are high and we're linking that to Parkinson's and also like a lot. And this is inflammation. So the optimal people, the bio, what do you want to ever call them? People like you, like me, that we want to be healthy and we want to live long lives. We want to have our brain, you just you're trying to detox every day. And having a mouth so close to your brain, and then there's retro axonal neurotransport that things can get to your brain easy, either through the bloodstream or through the nerves or down the gut. Yeah, there's the people that for them, they need to do it, but that's for them.
Hmm.
I try not to say need so much because that's what general dentists, hey, you need a root canal build up and a crown. Fortunately for them, that's what the insurance pays the most for. So they kill teeth all the time and they tell you need it. Um, and that's when I say, hold on a second, step back, try to look at the big picture.
Yeah. What's your desired outcome? How do you want to feel? How do you want to live?
That's 100%. The first thing you need to figure out is what is your motivation? Because if your motivation doesn't line up with what a biological dentist can offer you, then there's 100 dentists down the road
Hmm.
that can do it. If you want someone that covers your insurance, biological dentist is not that because the quality you get in the big picture, which is not emergency dentistry, insurance is not going to cover that much.
Mm.
So, so that's another thing is it is an investment. It's an investment in your. I say a lot of times, like with your case, it's like redoing a kitchen. Probably costs the same, takes about as long, but
Hmm.
it's the only thing you're ever going to have.
Hmm.
So I always think my wife wants me to redo my kitchen so bad right now, but some people redo their kitchen many times. So there is an investment there, but it is your health and the importance of it, especially if you're like you or me or your listeners, don't overlook it because it really is a part of the big picture for sure, and a big part.
Yeah, it's an important part to not undermine the financial investment that some of this takes. When I was going through my cancer journey, I did not have that money sitting in my bank account. I remember the first time I went and he gave me a quote. I think the first quote was $40,000. And I'm like, God, where is this coming from? What is my pathway forward? And I just ended up getting creative. I started a juice business to fund my cancer healing journey. And I found a lot of different entrepreneurial ways to really fund my health. I had to. People on Instagram will say, oh, must be nice for you to do all of these healing therapies. I'm like, I had $1,000 in my bank account when I was diagnosed. There was no savings. There was no money, emergency money sitting there. Like I, just like everybody else, had to figure out how to prioritize my health. So I understand the financial investment that comes from some of this stuff. And I'm not immune to being the also the person who said, how God am I going to figure this out? What is my pathway forward? Not woe is me. Well, I guess I just have to stay stuck like this. Other people are blessed and I'm not. No, I got into creative mode. I sat down, said, how am I going to fund this? How am I going to take care of myself? I'm going to be here for my son. And I was also navigating a cancer diagnosis. So I could also see somebody who's like, okay, I'm hearing this, but I feel pretty good. I don't know that I'm ready to go and invest $40,000. But we always want, that's why we get to focus on prevention, always focusing on prevention instead of like emergency intervention, which sort of brings me to a question that I had is about our children. I'm a mom to three boys, and obviously this has been a big part of my journey, and we always want to prevent our children from going through anything that we went through. What do you recommend as for like daily oral health for children, so they don't have to navigate something like this in the future?
Well, it's not fluoride, I'll tell you
Okay.
that. And I don't, I think it's an old argument. I never talk about fluoride much anymore. Um, it's diet. getting the right nutrients. Zinc deficiency, you can see caries. Vitamin D deficiency. There's a lot of research just showing the differences between kids that were like given fluoride and kids that were given, the proper nutrients, and you almost see that this does better.
Hmm.
So again, I don't mess with fluoride so much, but when the government's saying so much, it's such a bad thing to get rid of the fluoride. I say, hey, because again, this is done mostly in the low income areas, is let's take away the Doritos. Let's try to take away those things that are inflammatory. The sugar, huge. We know that. The gluten, it's inflammatory. Dairy in a lot of people is inflammatory, in the wrong dairy, of course.
Hmm.
Certainly oils, processed oils, we're seeing a lot more with that. Meats that are, high in omega-6s because they've been grain fed. I think that's where to go, is
Mm.
go first to diet, because that is going to be in prevention. It makes a huge difference. And again, that's what I saw when I came to biological dentistry, is these people they were gluten-free walking in the door. I was amazed. I never had to do scaling and root planing, the periodontal stuff anymore. And I
Hmm.
was so happy because I didn't like that anyway. The gums weren't bleeding as much. They may have had other issues, root canals, things like that, and they were looking to fix it. But that diet, man, it's where it really has to start.
Yeah.
And people are waking up to this. They're seeing this, and I think they're going to find that their kids are better mannered as well. With folate, issues and deficiencies and things like that. That's where I would say is number one. Of course, going to the dentist is important. I think to be able to be in a place that you can be comfortable, because a lot of times the first time a kid sees a dentist, they get a tooth extracted, and then that's it,
Hmm.
until it's disaster, and that's not good. But does that answer your question? Diet, 100%.
Yeah, it's interesting to hear how much you being in people's mouths, you've seen this connection of diet and oral health. And I remember seeing the study that Weston A. Price did. Um,
Yeah.
the people living out, the tribes living out on the land, and they had these big, wide open mouths and big teeth. And then we have this a lot of like, because of our industrialized and conventional food, the narrowing of our palate and our mouths. And I know that's something that I've inquired about for my children, is like, is this some like the like palate expanders, expanding the palate of our children so they don't have these narrow mouths. I see a like biological pediatric dentist here in it's in Spicewood. It's called Homegrown Pediatric Dentistry. And they do some like myofascial
But
exercises to lay the foundation of that oral health. And then if needed, you could do a palate expander. So um, she was like, your kids are still too young for something like this. Just keep feeding them well, keep taking care of, essentially their gut, their overall health, giving them supplements, things like that. But I do find that it's something that those of us who are conscious about this are mindful of for our children, are their wide palates, which changes the shape of your face as well.
I mean, tongue position is huge. And are they mouth breathers or nose breathers? And there's a lot of ways to train that in kids. I think the sooner they can be addressed, if there is expansion, that's, I think, is what and I'm not a big sleep dentist. I don't see a lot of kids, but I have kids. I do think that is a very big, the airway is huge. You really want to breathe through the nose, and there's so many modalities to promote that. And I think, yeah, that's very important.
Okay, so mouth tape, yes.
How often should you breathe through your mouth? Do you know the answer?
Never.
As often as you eat through your nose.
Okay. All
Got
right.
it?
Okay.
All
All
right.
right. I don't eat through my nose.
Yeah, no, no, not often. So yeah, I mean, I think that's a big area. And yeah, the whole Western price thing of once we process food, everything kind of went haywire. And that's anthropological studies just clearly show that. So it's fascinating. The diet, again, the sugar is probably a big part, processed stuff. That goes right along with the problems that we've seen in the recent 100 years, 100, 200 years. Yeah.
Okay. So tongue on the roof of the mouth,
Yeah.
breathing through the nose.
Yeah. Tongue to the roof of the mouth. That's it. Yep.
Okay. I have a 10-week old and I'm holding him and I'm like gently closing.
Yeah.
Closing his
Close
mouth.
it out. That's what you do. Yep.
Hmm.
Exactly. Yeah.
Beautiful. Beautiful. I love it. And then the last one that I really wanted to ask about, we kind of talked about metals, we talked about fillings and titanium implants, root canals. Talk to me a little bit about cavitation. So it's just such a everyday practice that people have their wisdom teeth removed and then they can have these cavitations. So what are they and how can they potentially be affecting people if they have them?
Yeah. Cavitations, that's kind of a newer, not newer. It's been around Western. I mean, we've known about cavitations in other places of the body too. It's in the literature,
Mhm.
but it's just starting to be talked about a little bit more.
Okay.
There's a doctor, Dr. Sharm Gennady. He's in Frankfurt. He is a PhD plastic surgeon, oral surgeon. He's leading the way on that through Tufts University. It's great. Me and several other biological dentists are part of the residency program there, doing a lot more studies. There's also Johann Lechner in Munich doing a lot of studies. So basically, when you take a tooth out, um, the body wants to close the tissue.
Hmm.
And so in closing, if that site wasn't preserved well enough, it kind of closes over the top and then the inside doesn't really heal. Now, there's a couple reasons why we're postulating and testing it, because it wasn't cleaned out well enough. It was a traumatic surgery, which, oral surgeons take teeth out in 2 seconds, so they're not always the most delicate. If the site wasn't grafted properly, then there wasn't bone there to begin with. So the body, again, it forms this little dead pocket. And they've been called cavitations, they've been called FDOJs, NICOs, a couple of different names, but they're cavitations. And we're studying these a lot more. And I would say most people have them. If you had wisdom teeth removed, you're like, okay, well, why did they form? Well, again, body closing. Two, the nutrient deficiencies. When you were in college, I don't know when you had your wisdom teeth taken out, but, were you high vitamin D, high nutrient, high regenerative?
Same
No,
here.
no, no. We were doing whatever we were doing a lot of times. And so I think those sites don't heal well. And then if there's a fatty pocket there, it's fat. It's going to harbor toxicities. I'd say nearly 90% of that I've tested have Lyme in the pockets, test positive for, and then a slew of bacteria. So I think there's a lot there, especially for the mold toxic patients, the Lyme patients, heavy metals, pesticides, all the stuff that we've incorporated, in the last 20, 30 years. I think they end up here a lot. And that for some people, again, not everybody, but boy, the people that they just can't get over their chronic fatigue or their inflammatory conditions. A lot of times, if they're cleaned out properly, bone cleaned to good bleeding, grafted so they don't recavitated, regenerative capacity up before, they sometimes have these great transformations, just like you did.
Mm.
And it's amazing. I think there's a lot to be seen in that in the coming years for sure. Just to go a little more, the cavitated bone, we're testing that, and you see this cavitated bone around titanium implants as well.
Mm.
So it's unhealthy bone, anything metal or dead. Again, you start to look because there's going to be an inflammation coming from those, and that's going to affect the whole system. Different for everybody, but certainly contributing. And for some people, it's very detrimental, is what we've seen.
Yeah. When someone's looking for a biological dentist, I bet there are people who call themselves biological dentists, but they're not. It's I mean, is there like a regulation term? How do we find really good biological dentists is my question.
Yeah.
Like, what are we looking for?
Yeah, we're really trying to get a better association for that, because it depends on kind of what you're looking for, because there's restorative dentists and then there's surgical dentists, and then there's both. Like I do both. The IAOMT had been a really good program, that's or good association. That's the International Association of Medicine and Toxicology. Um, and then there's a couple other ones. There's some forming now out of Europe, and I would say it's not easy. I think you really need to look at what was their training. If they're doing cavitations, I think they for sure should either be trained by a Dr. Wall, who does training on this in Utah, or Dr. Gennady. Anybody else, they can be very good at it, but it's a risky because it's on the fringes, and there's dental boards that are gonna always be critical of on the fringe work always, because there's no promise to it, and there's still people denying it. Um, it's I think you have to go and see, is their intake super comprehensive? And then what is their training for what they're doing? If they're taking Mercury out, they need to have special training. It's smart training is what that's called. There's one in Europe that's a little different. There's another one in the US, but it's a really good training on how to safely protect not just the patient, but probably mostly the employees. So that's what I would recommend. Anybody can call themselves holistic, but you can very much weed out people. Are they doing root canals? Are they using fluoride? I guess. Where do they stand? How do they take the mercury out?
Hmm.
How do they treat the cavitations? I think a really good treating surgeon is using vitamin C IV.
Hmm.
You're not bombing the gut with your antibiotics. I think that's my personal take on it. And they're using PRF, which is your blood concentrates. And even most recently with the cavitations, they're probably grafting it with a mineral synthetic graft.
Hmm.
And that would mean, boy, they know what they're talking about. If it's not any of that, you know, I would ask around and just really say, where have you trained, and get a sense of their experience.
Yeah, that website is a website that I've recommended for a long time. We'll put it in the show notes as well. But those are really valuable questions to be asking so that the patient feels like they're empowered. Like, who did you study under? Are you using IVs? Many of the things that you just listed, those are great questions to be asking a dental office to make sure that they are going to be a good fit for you.
How was your surgery? Did they use an IV for you? That was a little time. Yeah.
Yeah, and I actually did a bone graft for mine.
Yeah. And the bone graft would be a whole nother topic is,
Yeah.
do you use human bone? We're trying not to because it's showing that it's not always clean. The
Hmm.
Europeans use human bone and would stand behind it all the way. We're using more of a synthetic bone, and we even have vegan from red algae bone, and it's a mixture of hyaluronic acid and beta tricalcium phosphate. But everything is biologized by using your blood concentrates.
Yeah.
Um, I think that's very important and very helpful. But the most healing comes from the patient.
Mhm.
So that's probably bigger than anything is you get somebody that's like, yeah, let's pull that root canal. What I get it if it's an emergency, but if they're not like, hey, what's your vitamin D level? At least ask that
Mm-hmm.
because, and then who's your functional doctor, and are they on board? Because so many people, especially with the chronic mold and Lyme patients, they don't have a doctor because they've been through three of them or four or five, and they do their own thing. Those are the patients that I get more concerned with because they're hard to manage. They don't have the team. The team part is a big deal in this profession, and especially in a case like yours. You need your people, and you need your people to talk
Hmm.
because they gotta work together. If complications happen, and you need to be ready for it, and you need to be in a good relationship so that you can deal. And we don't allow finger pointing. I think that is a big thing that people often do because they're angry, and I get it. They're in pain or whatever, but you got to have a relationship. It's so important, for
Yeah,
healing.
I love that you said that because I talk a lot about building your team and that it can't just all fall on one person. It can't just fall on your dentist or the functional medicine doctor. I mean, I say you, me, has to be the head of the healing team, right? Like I'm the conductor and then I'm calling in all of my people and I'm getting opinions from each one and I'm having them talk and you have this healing team when you're in a healing crisis, like I really was. So I love that you noted on that. And the first biological dentist that I went to was down in Florida, and I no longer recommend him because, like I said, I think that there were some things that were done incorrectly in regards to getting the infection out, and when implants were put in, but I now work with Healthy Smiles for Life in Marble Falls, which is just an incredible organization. I've recommended them to a lot of people. They do IVs, they do acupressure, they pray over you. They have a big team that they refer out to for any more like surgical needs. So I go there every 6 months and get my cleaning done. They do, a swab and check the bacteria of my mouth. So I am very regimented with my dental care, as you could as you
That's
could
a
imagine.
that's a Dr. Nunley. Yes, is that right?
Yeah,
Yeah.
yeah, yeah.
Just wonderful people that they came to Gennady because again, they're in the Gennady's training, which is that's who's looking at cavitations the most, their association is called Amore,
Hmm.
and it just was formed, and so I'll give you information for your listeners too for that. But yeah, I mean, having a good relationship, it's key for healing because when you go there, you need to feel the love and your body's got a cellular energy, right? Yeah, I love
Hmm.
that.
Yeah. So before we wrap up, I'm just curious if there was anything that I didn't note on, anything that I didn't ask that maybe feels relevant for people to know about their dental health and how to best take care of their mouths and their whole bodies.
We didn't talk a lot about the titanium implants because that's always a kind of a question. There are some tests you can do for sensitivities,
Hmm.
and a lot of those actually are in Europe. But a ELISA test is helpful if you're on the fence and like I don't know, do I take it out? Because there's risks in everything you do. I would say that for sure is and I tell patients, look, if you're on the fence about doing this type of work, I am not your guy,
Mm-hmm.
because you need to be sure in what you're doing. You need to believe in you. Hey, that's huge. You need to believe in the doctor, the treatment plan, and the facility that is treating you. If any of those are a no-go, you're not ready.
Hmm.
And and there's a lot of dentists out there. I'm not everybody's dentist. I don't expect to be, but I do tell patients, look, you if you're doing something that's considered elective by a dental board, you're always putting that dentist at risk, and they're there to help you. And there are risks, but if you're on board, your practitioner, your doctor's on board, and your dental dentist is on board, man, you're gonna have a great healing, even if you have a complication, because you got your team. That'd be my closing recommendation for sure.
Mm. I love that. Beautiful. Have you brought in hydrogen water yet? Is that part of your immune support for patients?
Yeah, well, we have a Kangen which has high hydrogen water content, and
Mhm.
we've been giving for sure hydrate them with that. But the IV is probably your best hydration,
Mhm.
of course. But I love hydrogen water, and since we've gotten a Kangen, I mean my whole staff they all load up their jugs every week, and it's great. But that has a high hydrogen content. I know there's some other units, and I'm 100% like you have to have clean air. You have to have clean water. This is all part of that and then, reduce the sugar, the gluten, the dairy, and the processed oils and meat. And that's a big deal. Just sometimes like with Jane, the water is such a big deal. It changed her life. And
Yeah.
and patients so often they're still drinking tap water. I'm thinking every water tested in Colorado has forever chemicals in it. So get a good filter system. I love hydrogen water too, because I think it takes away all the aches and pains. It's great. As a former I still try to dance, but kickboxing is a little better, and it really does make a difference. So yes, are you?
Yeah, yeah, we didn't dive into that at all. That's how we were connected was through Jane, and I'm a huge advocate of hydrogen water and really working to get it into as many homes as I possibly can and show people the benefits that filtration is step one, and then activation, getting it infused with this anti-inflammatory, antioxidant-rich molecular hydrogen is step two. And what I love about it is that everybody drinks water. Every single human being drinks
Yeah.
water. There's some people I'm not going to get to do a coffee enema or drink green juice or maybe even get to a biological dentistry. But if I can meet them with their water and get them to make that upgrade and start feeling differently in their body, it's a really powerful open door for other things to come.
Yeah, and you're mostly water, so it was those studies by I think Emoto. If you sing, I would tell my kids, I'd always be like, sing to your water before you drink it, and they'd be and then, because your water carries energy.
Hmm.
So consider that. sing to your water. Love it.
I love it. I'm gonna start singing in my water. I've seen those studies for sure, but in the day to day, I forget. But you know what? Today I'm singing in my water in your honor. So I'm super grateful to have you on the podcast. Thank you for sharing your wisdom, your knowledge. I will put all of the contact information for Dr. Popp and his practice in the show notes, along with a lot of the resources that we shared today. And yeah, I just really, if somebody listening is going through something physically where you just feel like you haven't had answers, like you're that person who you've gone to all of these doctors and no one's giving you answers, go visit a biological dentist, get the cone beam scan done, let them look in your mouth and see what's going on. Because I know for me personally, it absolutely changed the trajectory of my entire life to get that infection out of my mouth. My skin is different, my are different, my energy is different, the expression of my vitality is different, and so I will forever and always sing the praises of doing proper dentistry.
Oh, Carla, you're an angel. Thank you for doing what you do and reaching people because I think there's a lot of people that are going to be improved and optimized and even saved by your help. So appreciate it very much. Thank you for having me.
Thank you so much.
You
Bye bye.
bet. Bye.